myself. My name is Savera, and I'm a clinical pharmacist here at Johns Hopkins Aramco Healthcare. Today, the topic I will be discussing with you today is drug-food interactions. So let's begin with the basic definition first. So what is a drug-food interaction? Drug-food interaction is basically a reaction between the medication and the food or beverages. Now, these interactions can happen with both the prescription medications as well as over-the-counter medications. And these include antacids, vitamins, caffeine, and iron pills. Why is it important? All right, so not all medications are affected by food. Some, though, are affected by what you eat and when you eat it. Certain foods may actually increase the absorption and the effect of the medication, while some will actually delay or decrease the absorption of your medication. Some medications cannot be taken with certain types of food, as that food will cause a reaction and that will change the effect of the medication. In some cases, it can even cause harmful or adverse effects. On the other hand, I'm sure you've noticed that sometimes you are told to take the medication with the food. And this is true. Some medications are actually easier to handle when you take them with food. And in fact, when you don't take them with food, you may feel nauseous or dizzy. This is often the case with some of the antibiotics. All right, so for the sake of the presentation today, what we're going to do is talk about 7 food groups. So we've divided the presentation into 7 food groups and some important medication interactions with those groups. So the first one is dairy products, then proteins, caffeine, fiber, grapefruit juice, tyramine containing foods, and lastly, the leafy greens. All right, so let's begin by talking about calcium. Now, calcium by itself, as well as there is a lot of foods now being fortified with calcium. So these, for example, include orange juice and bread, etc. So it's really important for you to look for the food labels to see if they have calcium added to it. Some of the important drug interactions with calcium include, firstly, the fluoroquinolone antibiotics. So these include, for example, ciprofloxacin and levofloxacin. And secondly, the tetracycline class of antibiotics, which includes minocycline or doxycycline. So these antibiotics actually can become ineffective when they are taken at the same time as dairy products or calcium supplements. The other medication class is known as bisphosphonates, and these include alendronate, risedronate, and ibandronate. So bisphosphonates are actually used to treat osteoporosis, and they have decreased absorption when they are given with any type of food or beverage other than water. And this is especially problematic when they are taken with dairy products. Also, levels of cefuroxime, which is again a cephalosporin antibiotic, is decreased when it's taken with dairy product. Other cephalosporins, fortunately, however, do not appear to be effective, and therefore they can offer an alternative for someone who takes a lot of supplements for calcium. In addition, methotrexate levels are decreased when it is consumed with milk-rich foods. I also want to mention something important here, that a lot of times people take over-the-counter antacids such as Tums, Maalox, and Pepto-Bismol. These actually have calcium added to them, so this is again something to be mindful of. All right, so what are some recommendations in how to counteract these drug-food interactions with calcium? So as we mentioned, it's important to read all the food labels very carefully to see if the calcium has been added to it. And also the administration of the dairy products and the calcium supplements from the medication should be separated by at least 2 to 4 hours. The second food group we're going to talk about is protein-rich foods. Now, protein-rich foods can also interfere with or potentiate the absorption of various medications. And consuming a meal high in protein, for example, and taking in propranolol can actually increase the effect of propranolol and unfortunately cause some serious adverse events such as bradycardia, which simply means slowing down of the heart rate, or hypotension, which is the lowering of the blood pressure and bronchoconstriction. High protein diets can also decrease the concentration as well as the efficacy of carbidopa-levodopa. Now, this medication is used to treat Parkinson's disease, and also theophylline, which is another medication used to treat asthma and lung conditions, has also shown interaction with protein-rich foods, resulting in subtherapeutic levels and unfortunately can cause exacerbation of conditions. So again, what are some recommendations for counteracting this medication interaction? So it's recommended to separate the protein sources from the medication administration, as well as to limit the total daily intake of protein. And in some cases, the healthcare provider will actually adjust the dose of levodopa, carbidopa. However, I want to stress here that you should never ever adjust the medication by yourself, the medication dosage by yourself. This should always be done in the supervision of a healthcare provider. So the next food group is quite popular. So caffeine, as you all know, is a high content of caffeine is actually found in coffee, tea, soft drinks, as well as a lot of energy foods and beverages. And sometimes the consumption of caffeinated beverages late at night, when taken with medication class or the medications that are used to treat sleep disorders, and these include, for example, zolpidem and temazepam, will actually result in sleepless nights because it counteracts, of course, the effect of that medication. In addition, this may enhance the caffeine's diuretic effect, which could, of course, be problematic in terms of fluid imbalance. The medication ciprofloxacin, the fluoroquinolone antibiotic we talked about earlier, actually also inhibits the metabolism of caffeine, which means it's going to result in increased effects of caffeine in your body. Now, the other fluoroquinolones do not appear to affect the metabolism of caffeine and therefore can be offered as an alternative for someone who consumes large amounts of caffeine drinks during the day. Oral contraceptives and prednisone also increase caffeine levels, and it's for the same reason as we mentioned earlier for ciprofloxacin, that they actually inhibit the caffeine metabolism and therefore result in higher caffeine levels. So pharmacists and other healthcare providers should actually warn the patients also about a caffeine interaction with theophylline. And this interaction can actually predispose patients to adverse theophylline-related effects, which includes jitteriness, insomnia, and cardiac arrhythmias. Caffeine also increases lithium reabsorption. So lithium is basically a medication which is used primarily as a maintenance drug in the treatment of bipolar disorder to stabilize mood and prevent manic episodes. Now, with the lithium and the caffeine drug interaction, caffeine will ultimately reduce the lithium levels. And if caffeine intake continues to increase, then this could actually potentially lead to treatment failure. And unfortunately, the patient can have a return of bipolar symptoms. Caffeine can also interact with some other medications, including antihypertensive. An example of this will be propranolol and metoprolol. And both these medications are used to treat high blood pressure, and their interaction with caffeine will actually make the medication less effective and result in a higher overall blood pressure. So if you are like most adults, caffeine is, I'm sure, a part of your daily routine. And usually the good news is that it won't pose a health problem. But be mindful of caffeine's possible side effects and be ready to cut back if necessary. It's important to keep tabs, which is basically paying attention to how much caffeine you're getting from food and beverages, especially the energy drinks. As we said earlier, make sure you're reading the labels very carefully, and if necessary, go decaf, because most decaffeinated beverages actually look and taste much the same as their caffeinated counterparts. All right, so the next food group we're going to talk about is fiber. Now, a high fiber diet includes fruits, vegetables, and whole grains. And studies have shown that high fiber diet actually lowers the risk of developing heart disease, stroke, and diabetes, which has made it quite popular. It's important to note, however, there are some important food-drug interactions with the fiber. For example, the metformin blood levels are actually decreased when taken with large amounts of fiber. Another medication, levothyroxine, which is used to treat an underactive thyroid gland and consumed with high fiber, as well as soybean flour and walnuts, can actually make levothyroxine less effective. And the same is true if you are taking digoxin, which is a medication that is used to treat heart failure. And high fiber food can also affect the absorption of digoxin. So the best bet is to take digoxin at least 2 hours before or after consuming meals or snacks that are loaded with fiber. Some studies have also shown that fiber supplements can reduce the blood levels of penicillin, and therefore it is advised not to take penicillin at the same time as fiber supplement. Other antibiotics in the penicillin class, however, fortunately do not appear to be altered by the use of dietary fiber, and so once again, they can offer a good alternative. All right, so recommendation to counteract this interaction, as we said earlier, the best thing to do is to take the medication at least 2 hours before or 2 hours after consuming meals or snacks that are loaded with fiber. Basically, what happens is that fiber goes through the digestive system without getting digested or absorbed. So it makes sense that if there's a lot of fiber and medication in the intestine at the same time, it's possible that the medication will get swept along with the fiber and it will be excreted instead of getting fully absorbed. So just to be on the safe side, it's prudent to take your medications 2 to 3 hours separate from your fiber supplement. All right, so the next food we're going to talk about is grapefruit or grapefruit juice. Now, as you all know, grapefruit is a chock full of vitamin C and other potent antioxidant, and it gives your immune system a nice boost. And therefore, it's a great fruit, actually. However, unfortunately, it can also affect some of the medications. And one of them is the statin class. Now, the statins are a very popular class of medications that are used to treat hyperlipidemia. And statins actually work by limiting the natural production of cholesterol. And what this does is it improves the profiles of the lipoproteins in the blood, and it decreases death from heart disease in patients who are at risk for it. So when you consume grapefruit or grapefruit juice with statin, it actually inhibits an enzyme which is necessary for the statin to be metabolized. As a result, the medication will stay in the blood and it will accumulate, which will unfortunately increase the risk of the side effects that are associated with statins, such as the muscular pain. Now, from this class, the atorvastatin, lovastatin, and simvastatin are the most problematic as far as the grapefruit juice goes. So to be on the safer side, patients are often advised to avoid grapefruit or grapefruit juice entirely while they're taking statin medications. Grapefruit juice or grapefruit can also affect some antihypertensive medications. And some of these include felodipine, nifedipine, losartan, and eplerenone. And the problem here is that when taken with grapefruit or grapefruit juice, this can actually increase the amount of felodipine, nifedipine, and losartan, for example, in your bloodstream. And this in turn will raise your risk for side effects and, of course, make it hard to manage blood pressure. Grapefruit actually can also cause problems when it's mixed with some other medications, and these include Buspar, quetiapine, and lorazepam. So these medications are basically used to treat mood and behavioral disorders. And when you eat grapefruit with these mood-related medications, this can actually result in heart rhythm changes, sometimes excessive sleepiness, and other very medication-specific effects. Also, certain corticosteroids that are used to treat Crohn's disease or ulcerative colitis, such as the Entocort or the Euceris tablets, both of which contain budesonide, can also interact with grapefruit juice, and as a result of their interaction, their blood levels are actually increased. All right, so in case of recommendation for grapefruit juice, it's slightly different because as earlier we recommended to separate the medication from the interacting food. However, in this case, even sometimes small amounts of grapefruit juice can cause severe side effects. So it is recommended to avoid the combination. If the interaction is present, just avoid the combination altogether. And one way of doing it is that to switch to an alternative medication if possible after discussing with your healthcare provider. All right, so the next one we're going to talk about is tyramine. This is not a food, this is actually a chemical which is found in food and beverages such as cheese, red wine, and certain beans such as fava and broad beans, fish or shrimp paste. Now, tyramine has a significant interaction with monoamine oxidase inhibitors. And these medications are actually used infrequently these days, but they are still sometimes occasionally used to treat depression, and they are becoming increasingly popular for the treatment of Parkinson's disease. One such medication is selegiline, and you may have heard about this one. Also, linezolid, which is an antibiotic, has some monoamine oxidase inhibitor properties, and therefore this also shows characteristics and potential for interaction with tyramine. And it is for the same reason that it's recommended for patients who are on linezolid to be used cautiously with someone who is also on serotonin selective reuptake inhibitors for the treatment of depression. Also, isoniazid, which is actually a mainstay medication in the treatment of tuberculosis, also exhibits the monoamine oxidase inhibitor effects and therefore should not be used in combination with tyramine-containing foods. All right, so the next medication or the group we're going to talk about is warfarin. Now, warfarin, the most notorious drug-food interaction is with green leafy vegetables. So basically, warfarin is a medication also sometimes referred to as a blood thinner, and this helps in preventing heart attacks, strokes, and blood clots. And as I said, the most notorious food-drug interaction regarding the warfarin occurs with green leafy vegetables. And the reason for that is that these vegetables are very rich in vitamin K content. So if you look at the mechanism of action of warfarin, it actually works by interfering with the synthesis of vitamin K derived clotting factors. So increasing vitamin K intake will actually result in more clotting factors, which makes sense then that would reduce the efficacy of the warfarin. Now, some people erroneously believe that warfarin recipients cannot eat any green or leafy vegetables. However, this is not true. If the patient remains consistent with vitamin K intake and they take their medication as directed, this interaction is actually not substantial. So some examples of vitamin K food sources include dark green leafy vegetables, as we mentioned earlier, such as kale and some other vegetables, including broccoli and cabbage. So the important thing here to remember again is that this is not problematic. However, if someone suddenly becomes vegetarian or they stop this food type or food category completely after they've been consuming it for some time, then that is when they will notice the adverse events or the changes in their INR levels, which is basically a blood test that is done and used by a physician to ensure that the medication is working as directed. Soy milk, char-grilled foods, and sushi containing seaweed may actually also decrease the effect of warfarin. And cranberry juice, on the other hand, can actually significantly increase the INR levels, which means it will potentiate the anticoagulant effect of warfarin. Now, the recommendation, as I stressed earlier, that consistency is the key with the warfarin in all situations. As long as you are consistent with your vitamin K intake and you are taking your medication as directed, then this interaction is not significant. So the last food group we're going to talk about today is potassium-rich foods. Potassium-rich foods include bananas, oranges, avocados, tomatoes, white and sweet potatoes, as well as the dried apricots. Now, sometimes if you're taking blood pressure lowering medication from a medication class known as ACE inhibitor or the ARBs, which is the angiotensin converting enzyme inhibitor or the angiotensin receptor blockers, then this could be problematic because you can get high levels of potassium in your body. And unfortunately, this can lead to potentially dangerous heart arrhythmias. So some examples of these medication class includes lisinopril, captopril, and ramipril for the ACE inhibitor, and losartan and valsartan for the ARBs. All right, so what are some recommendations for the potassium-rich foods? It is recommended that you limit your intake of potassium-rich foods if you are taking one of the medications in this medication class. And it's also recommended that some ACE inhibitors, such as captopril and moaxipril, be taken at least an hour before the meals. All right, so let's look at some strategies overall that you can use to minimize drug-food interactions. So one of them is actually communication and education. So increase communication and education for patients on what foods they should avoid. And as a patient, it's better if you can keep a care plan if necessary to help you keep track of the medications and what foods to avoid. Caretakers for the elderly patients, as well as the parents for the young children, should also be educated on potential drug-food interactions. And if someone is admitted in the hospital, then meals should be checked frequently for them to make sure that there isn't a possibility of drug-food interaction. As we said earlier, everyone is encouraged to read the food labels carefully and always take the medication as directed. So also read the patient information leaflet, which is provided with the medication, as it will sometimes give really important information regarding spacing the medication administration from the food, as well as to avoid certain types of food. Never ever hesitate to ask your healthcare provider if anything seems unusual. And they can always try to change your medication to something that is less interacting. And remember that some types of eating and drinking do not have to be abstained, even when the interaction is present. And not all drug interactions will require you to stop your medication. All right, so I found some useful websites in case you want to check for drug-food interaction. These are 3 of them. So the first one is the Drug Bank Food Interaction Checker. This actually allows you to search up to 5 drugs at one time, and you can check interactions for both food and drinks. And when you do the search, it will actually return any warnings or important considerations that exist regarding the timing of its administration with respect to meals, foods, and drinks to avoid, as well as recommendation on how to take the medication. So for example, if you search for the bisphosphonate we mentioned earlier with the calcium, it actually will tell you that this medication should be taken with a full glass of water, etc. The second one is the drugs.com drug interaction checker. And this one actually allows you to check for interaction between the drug food, as well as drug disease. And you can actually save your search and use it for future reference. The third one is Global RPH, and this is actually very commonly used by the pharmacists. And this website, actually, I found some useful drug tables, and it has some list of foods, some medications that can be taken with food, and then there's some recommendations for medications that should be taken on an empty stomach. So these 3 are some of the useful websites I found if you want to search by yourself. All right, so with that, we come to the end of our presentation. And I just want to thank you for taking the time to listening to our presentation. So thank you so much again.